Wales is the worst part of the UK for providing second trimester surgical abortion. That's according to a healthcare charity. The British Pregnancy Advisory Service says it's astonishing that Wales is behind Northern Ireland, where abortion was decriminalised in 2019. Our communities correspondent Kate Morgan reports.
Sarah, whose story is being told by a member of our team, found herself unexpectedly pregnant 2 years ago. After severe postnatal depression previously, she says she couldn't face going through with the pregnancy. She says she didn't want a medical abortion using pills because of a previous miscarriage, but was told she couldn't have a surgical abortion locally because of a medical condition that meant she needed general anaesthetic and to travel to England.
There was a bigger sense of guilt because I was being sent away. I was imagining people with placards waving and shouting. I didn't know what hospital it would be. Having to leave my 2 children, who I hadn't left for more than one night. What would we tell them? What would we do? It added a lot of extra stress and trauma.
In Wales, England and Scotland, abortion is allowed up to 24 weeks of pregnancy with the approval of 2 doctors. Surgical abortion involves an operation to remove the pregnancy from the womb. It may be done with conscious sedation, local anaesthetic or general anaesthetic. One leading abortion care provider says Wales is lagging behind the rest of the UK for mid-trimester abortion, with limited provision after 14 weeks.
Unfortunately, Wales is the worst place in the UK to access abortion in the second trimester. I find it quite astonishing, actually. Northern Ireland only changed their law in 2019. They have got a service that provides surgical services, beyond 20 weeks.
One Senedd member says the Women's Health cross-party group has been asking the Welsh Government to act on this for years.
We're not talking about thousands of women here. It's a relatively small amount of women who require this type of care. People are able to perform abortions in Wales. It's just that at the moment you can't access this late trimester abortion.
The Welsh Government says it accepts that improvements need to be made to services, and it fully acknowledges that women should be able to access essential healthcare closer to home. Adding that it's working with NHS Wales to address specific barriers to surgical abortion services and is exploring short-term improvements while developing a robust, sustainable service for the future. Sarah decided to keep her baby, but says she was shocked by her experience and hopes speaking out may help others in future.